Howdy YouTube family, it's Bolt CRNA coming to you again with another day's topic. So today we're doing a Q&A session with all of you guys from Instagram. I've got all of your questions here pulled up. I asked you earlier today to send me some of your random questions, whatever they are. No question's a dumb question in my book. So we're gonna go through some of the things that you've asked me and I'm gonna try and answer them real quick for you. Let's get into it. So T.Ha says, I'm a first year nurse student and I regret every second that I'm not a doctor. Do you feel the same? That is so interesting, T.Ha. I actually am a doctor. I'm Dr. Jason Bolt and I'm also a nurse anesthetist. So maybe when you say by not being a doctor, you mean being a physician. So no, I don't regret not being a physician and I hope that you don't. And being in your first year of nursing school, you have every opportunity to go on and become a doctor. There's the sky's the limit for you. You've not set your future in stone yet. You can get your bachelor's of science in nursing and then go on to med school. There's plenty of people who do that. So if you really want to be a physician, you should definitely do that. Sawyer Howard says, were you stressed during your early ICU days as an RN? Yes, very much. Yeah, my time in the ICU as a new grad nurse was very stressful. I think being a new nurse in general is a stressful time, but when you're a new grad straight into the ICU, it adds an extra level of criticalness and just anxiety on top of you. Especially if you're working night shift, which most new grads get pushed into night shift where there's not as much support staff or mentoring going on, and you're kind of just expected on a bare bones crew to figure it out. Our unit had fresh open hearts, we had CRRT, we had intra-aortic balloon pumps, we had it was a mixed unit of cardiac and CV and medical and surgical ICU patients in a pretty large regional community hospital. And there was no nurse practitioners at night, there was no physicians who stayed in-house except the ER physicians. And so pretty much as ICU nurses there, you were expected to function autonomously and figure out most everything at night. Because if you called and woke a physician up at home over something that you could have maybe ordered or done yourself, you were going to hear about it in the morning. So you learned we had standing orders for different drips that we would start. If this baseline of this was happening, we would start dopamine, and then we had a certain amount of titratable ranges we would start it at. If we needed to start Levophed, we had orders to start Levophed, and we really didn't call a physician about it. We would let them know when they'd come around in morning rounds and see their patients in the morning and say, hey, we had to start Levophed last night at this amount, and they're more stable now. So yeah, it was very stressful as a new grad ICU nurse, but I also feel like it made me very strong as an ICU nurse. And 2 years of doing that really prepared me to go be a travel nurse and step into a lot of different ICU environments and be comfortable and capable of handling a lot of different things. And it also prepared me for later than going to CRNA school. Tarunjit Singh asks, writing personal statements. So what I tell people about personal statements is you want it to be personal. It needs to be something that's unique about you. It needs to be about why you are where you're at in life right now. Why are you writing this personal statement out right now? Why are you putting forth all of this effort to get to this place? If your answer is you want to go to school to make more money, you want more autonomy, you like pharmacology, those are terrible answers. They're boring, they're bland, and they're cold. They're not personable. They will not like that stuff. So you need to talk about you. What makes you interesting? Talk about that. Brent Dow says, would you recommend applying to schools with 2 years experience or more? I do recommend that you should I don't recommend students applying to programs when they still haven't even got their year's experience yet. I think that's too little amount of time. I think most programs will agree. I have spoken to Dr. Kim Kimball on here, who's part of the boards that take in students, and she also confirmed that it's more of something they look at and say, hey, you have barely a year's experience. This is not great to them. 2 years seems to be the experience level that they say, okay, this is good, and then 3 or 4 is great, and then beyond that, once you start getting into like 5, 10, whatever years, they start actually thinking about it as in this person may have been out of academics for so long, it may be hard for them to keep up with the coursework. So yeah, there's a golden era in there, and I think between 2 to 5 years is your best time. Marianne B says, did you find it difficult to find a CRNA job in California after not going to school there? Heard it can be hard. There's tons of CRNA jobs in California. are they jobs you want to work in is another question. And also, it is difficult. I will tell people who haven't rotated somewhere as an SRNA to be very cautious of taking jobs, especially cross country, because you don't really know what you're stepping into. When you take a job as a new grad, make sure that you have a friend who works in that practice, you've rotated in that practice as a student, or you have really reliable sources that you trust that's telling you this is a good place for you to be. Because you do not want to step into a bad, toxic practice that you did not realize was going to be that way as a brand new graduate CRNA. Julianne Morrow says, do you know anything about a locum CRNA job? I've recently heard about this and I'm interested. So being a locum CRNA simply means that you're a contractor. It means that you contract a certain amount of your time for a certain amount of money. And they pay you as a 1099 contractor, which means you handle all the taxes yourself, and you have to get your own malpractice insurance, and you have to get all your own health insurance, and there are no benefits built into it. They just give you like straight liquidated pay. They may say, we'll pay you $1,800 or $2,000 a day that you work for them. And that's what they do. So every day you work for them, they pay you that much. And it's usually for a certain amount of time. They may say, we only need you for 5 months or something. And then you move on. So yeah, it's pretty much like you just handle yourself like a business and you're an independent contractor. That's being a locums CRNA. And for context, it's not just for CRNAs, physicians do that too. Love X Elena says, what's your favorite thing about being a CRNA? Favorite thing about being a CRNA is being able to come in and talk to a patient at a time where they're very vulnerable and nervous about maybe a major life-changing surgery they're about to have, and to know I'm the guy who gets to bring their anxiety down, whether it's through verbal stuff or medications. I'm able to help them relieve some of their pain, get them safely through their entire surgery, wake them back up, and have them say, are we done already? When they wake up from surgery. That's what I love about being a CRNA. Gumpy Mick 12 says, how are you managing your loans? How can students succeed through this pandemic? I'm managing my loans by paying thousands of dollars in lump sums every month. I try and do about $5,000 a month. Now, being successful in this pandemic, by students, I assume you mean SRNAs, and how they can be successful during this pandemic is staying focused. I know it's hard because you're not in lecture, nobody's standing over you making sure that you're studying or doing what you have to do. Your clinical schedule got thrown off. It's frustrating. That didn't happen with me and when I was in school, so I can't pretend that I can relate to exactly this situation. But what I would do if I was in this situation is try and keep motivated. I would study even though nobody was forcing me to. I would try and stay ahead of the game. I would go through and review a lot of the clinical skills that I had learned in the past. Try and keep fresh on these things. You will be back on the ball soon. Things will keep rolling and you will be expected to keep rolling quickly as soon as it does. So don't let yourself get lazy or behind. Addison Russo says, do you prefer working in a care team or being more autonomous? Well, Addison, that is a complex question. So when I'm dealing with complicated patients, like say in the cath lab who has really low EFs and Wolff-Parkinson-White syndrome and all kinds of other complicated issues that make them at very high risk, I enjoy a care team environment. Not because I feel like I'm not competent or capable of handling these situations, but because these are patients who benefit from having two heads who can take care of somebody and two sets of hands at certain times. There are times where just setting up all the drugs and all the things, sometimes you need a little help, and to be able to go do the pre-op and set up all the drugs and set up your art line supplies and do everything else, it's very time consuming, and so it's helpful sometimes to have a second person who can help you with those things. And what if someone else has had a lot more experience with Wolff-Parkinson-White and maybe you haven't? So that's helpful sometimes. And that's just a quick example of exactly what I think a care team is good for. If you're doing major liver transplants or, cabbages and things like that have a lot of moving pieces and they have really high risk, and the risk of people, dying on you or having major complications can sometimes be great to have a second person who can help you kind of prepare for those situations. Now, for your typical ASA 1, 2s, 3s, your AV fistulas and your hysterectomies and your lap choles and all that, I love working autonomously and have a background in working in total autonomy in those situations, putting in my own blocks, my epidurals, managing OB solo, all that stuff. I can do all that, and I feel like CRNAs are perfectly well trained to do that totally solo. Damon MD says, challenge for student who don't speak English as primary language in CRNA school. Yes, if you're in America and you're trying to go to CRNA school, which is going to be, it's doctoral for pretty much everybody and will be in the future, you have to write lots of papers, there's lots of speeches, there's lots of research, and if English is not something you have a very good grasp on yet, you're going to struggle very hard. Nurse Timber says, tell us more about how CRNA school shaped you, personality, work habits, etc. I'll say CRNA school made me more organized. It forced me to demand excellence, which sometimes can be detrimental in your personal life because it crosses over. It's not like you can just be a certain way when you're involved in school or work and then go home and you're a totally different person. This mentality that the standard of what I was held to, of perfection, that kind of became my own mentality of what I expect of myself. And then you go home and you're like, why is my dog not being perfect? Why is he not, getting the treat the way I want him to? And the same thing goes for your family. Like, why are they calling me right now? They know I'm busy. They know I'm at work. I feel like people, me specifically, I guess, but probably other people too, you get shorter with people. You have less patience for things. I feel like I'm more demanding now and probably more judgmental, which is something I'm trying to work through, to be totally honest. But in the clinical arena, your mind is designed and forced to be very quick about judgments, and you need this done now, and this means this needs to happen now, and you have to direct people to do these things sometimes. So your mentality and your ability to do that, the patient's life can depend on it. So you get in that habit of doing that, and then you can go home and maybe talk to your girlfriend in a tone of voice that's not as polite as it should be. So those are just some things that CRNA school may change about you. Not saying it has to change that about you, and I'm not saying that you can't do personal work to try and separate that. LL Bean says, your role if they would have allowed CRNAs to practice on ICU floors. I don't know what you mean, LL Beans. Some CRNAs did go to ICU floors during the COVID pandemic. Maybe that's what you mean. They did go to the ICUs and manage ventilators and things like that. So yeah, that happened. Do you mean like in our just normal practice, if we just went to the ICU and managed things? I think that would require an extra year of a fellowship, just like physician anesthesiologists. There's an extra year of critical care fellowship they do to train them on more specifically how to manage long-term ICU patients. And then LL Bean's next question was CRNA fellowships and their future. Is there value to them and how they'll change things? There is like 6 or 7 accredited fellowships right now. They're all about a year long, I believe, for CRNAs. They're not mandatory from the majority of jobs. If you plan to do more of like advanced regional or use like fluoro or pain management, things like that, I would highly recommend doing one of these fellowships. It does look good on your resume, and it does kind of convince some of these hospitals that you may be talking to about covering these services for them that you have some education and training in them. Austin Kaiser says, what is the best way to approach your manager when applying to CRNA school? Well, after you've done a year, that's another reason why I tell people to usually get a year plus of experience, because your ICU nurse manager is going to be very upset if you just got off orientation and you're already applying to CRNA schools. Like, they just spent time investing in you and training you, and you just pretty much used them. And I know other people say like, it's no big deal, it's your goals for CRNA school, screw them, who cares about your nurse manager, they'd screw you over too. Yes, in a way, but there is a karma to things, and there's also a certain professionalism you want to have. If you give somebody a commitment and you say like, hey, would you do this thing for me? Don't just stab them in the back as soon as they do that thing for you and train you in their ICU and give you a spot. Like you've really taken a lot of their resources up, and now you're giving really nothing back. I'm not saying spend years in their ICU unit, but give them a little bit of time. So if you've given them a little bit of your energy and time, then they shouldn't be too upset with you when you tell them you have to go to CRNA school. Honestly, there's not a wonderful way to tell them this, because none of them are going to love this idea, because it means they're losing a staff member that they're going to have to replace. But if you come to them with good respect and you have a good relationship with them, they should be okay with it. Brent Dowell asked, did you need more classes after graduating with your BSN to meet the requirements for CRNA? No, I didn't. And I specifically picked programs that did not require extra courses on top of all the courses I had to take for my BSN. I spent 4.5 years full time getting my BSN. Young Lion Jr. says, were y'all getting to do block solo, or does MD place needle and SRNA aspirate and inject? So they pick up on a good aspect of SRNA training at a lot of clinical sites. The physicians who are doing the blocks will not let you usually do them 100% solo. They're going to be standing with you, they're going to be assisting you, they're either going to be holding your hand while you're holding the needle, or they'll insert the needle and then let you guide the needle with the ultrasound in your hand. Like, there's a lot of hand holding, there's a lot of involvement by them. I will say that the CRNA only practices that I rotated in, which my program had 3 of those CRNA only practices, those practices pretty much said, hey, here's your stuff, like, I'm gonna be over here, holler if you need me. And you did the block. Like, I did erector spinae blocks like that, I did adductor canal blocks like that, I did tap blocks like that, I did interscaling blocks like that. So yes, in those clinical sites, I did get full autonomy at doing blocks and all that kind of stuff. The other sites, I took the best elements of it that I could, and I pushed to do as much autonomously as I could. You have to advocate for yourself, or you will not, they will not hand it to you and let you do it by yourself unless you really push and advocate. So be your best advocate for yourself. Caroline Law says, applying to an L1 level 1 CV SICU after 2 years neuromed surge. What clinical questions should I prepare for? I would be prepared for a lot of questions about cardiac disease, about cabbages, about pharmacology with, like, say, dobutamine and epinephrine and norepinephrine and milrinone. These are all drugs that you're probably going to be giving or using a lot in those environments, and they'll probably want to know that you have a general idea of what these are. Cole SRNA says, can you explain billing as an anesthesia provider? Is this reimbursed on top of salary? So that's kind of like if you're a 1099 or you independently bill yourself, you can do that if the practice is set up that way. If it's not set up like that, most practices are not set up like that, where you independently bill yourself. You sign a contract at that hospital to allow the anesthesia group to bill for your services. You sign away your NPI number, which is your billing number essentially, to the group, and they say, hey, we'll give you this amount of salary per year as long as you work full-time hours for us and allow us to bill your NPI number for all the cases you do. And so that's kind of the agreement most people make. But if you want to work in an independent way, there are certain places that let you bill independently of all your billing. And of course, anesthesia is billed through like RVUs and, you know, time units, like 15 minutes. And, you know, if they're ASA class 3 or 4, you get a little bit of a differential. And there's all kinds of different ways that you bill, and it gets very complicated. Jay Sunny 96 says, if you could go back in time, would you change careers or done something differently? No, I wouldn't have. I would have done everything the same. Sriracha Frank says, what's your favorite local anesthetic procedure? Probably a tap block. I find it very satisfying to watch the hydrodissection of the planes when you're injecting the local anesthetic in between the 2 layers of muscle. Honey Nicole says, what is a good GPA for CRNA school? I'd say anything above a 3.3 or 3.4, you should be okay, as long as you're a good interviewer and you have other things that boost up your application. Julia Ruck says, what are side hustles as an RN, specifically as a new grad? I don't know, maybe YouTube? I don't know of many new grad RN side hustles, because you're literally just licensed as a new nurse and you don't really know how to be a nurse quite yet. So not many people are going to want you to try and, you know, freelance or do something for them because you don't have much foundational knowledge yet. In Square 32 says, any tips for a CRNA starting at a new place? I would say be patient with yourself. Understand that those couple months of being out of practice in between taking boards and waiting for credentialing, you're gonna feel a little rusty when you start back. You're gonna feel a little bit like you've forgotten things, but you haven't. It's like riding a bike. You'll start back quickly and you'll be on the ball again. The Physique Shop says, someone brand new to nursing school with ultimate goal to be a CRNA. What's my biggest piece of advice? Set small goals, meet them, celebrate yourself every time you meet a goal. Future CRNA 20 says, when you lose motivation in CRNA school from time to time, how do you get it back? I look at the massive amount of student loans that I have accrued and realize I am in debt so much I have no other choice but to plow forward. Travis.P 2020 says, what would you consider a lowball salary to be offered for a new CRNA? I would say that there's a lot of factors that go into that decision. If you're working minimal hours, taking no call, working no holidays or weekends, you know, having wonderful benefits and, you know, 401k matching that's really great, and free health insurance, all those kind of things, and you live in a very cheap, low cost of living area, I'd say 150 is acceptable as the lowest I would ever consider, even for like a simple lifestyle position. And then, you know, you would go up from there to, you know, 250, 300,000, depending on how much work you're gonna have to do. Drew.Benning says, how did you choose which school was right for you? I made up a list of all the programs that met all the needs that I had. Roni05 says, review of drugs every ICU nurse should be familiar with. If you're gonna be an ICU nurse, I would say review propofol, phenylephrine, norepinephrine, epinephrine. That's all the only ones I can think off the top of my head. Sheila Murph says, at what point did you start feeling comfortable doing cases on your own? Probably as a third year in the program, mostly because they forced us. It was pretty much like your second year, you're still kind of in the nest and they kind of hold your hand a lot and they don't usually leave you totally alone in the room for long. And then you start third year, day one, and over the weekend they suddenly expected you to become miraculous and they just shove you out of the nest and they say, you're in the room by yourself all day, these are all your cases, you're expected to cover these. There's a physician covering you and another student in the other room, call them if you need them, and you go. And it happened to be my pediatric rotation too, at a complicated pediatric hospital. So yeah, we had CRNAs, we had open hearts, we had all kinds of stuff on little babies and neonates, and I was in a room by myself. So actually, I take that back. They gave us 3 days to be allowed to be with a CRNA on that rotation. And then on the 4th day, they're like, these are your own cases. Good luck. John Takes Photographs says, what new grad salaries were you offered and where? Also California pay. I only looked at jobs that paid 200,000 plus. I didn't even consider jobs that pay anything less than $200,000. And then he also asked, are you using your full scope of practice in California? Well, I've had 3 jobs in California, and each of them have varied amounts of skill that I use in each of the jobs. So yes, you have every ability to do that here in California, and you have every ability not to do that here in California. It's up to you and where you're practicing. And his final question is, what % of your take-home pay is your gross pay? And I tell people this all the time on my stories when I complain about taxes in California specifically, is I lose like 39% of my gross to stuff, and it's usually, you know, FICA and federal and state and all these other taxes. It's like 39%. Brunt Burrito says, at what age did you become an RN and what age CRNA? I became an RN at 24 and I became CRNA at 31. And our last question is Joe 57937 says, what can a CRNA expect to make in Santa Clara, San Jose, and Sunnyvale? I would say between $220,000 to $250,000 a year. If you're making less than that, you're insane, because this place is so expensive to live. You should not be taking pay less than that. Well, all right, that was a long video, but I got to all of your questions and answers. I hope that answered everything. If you guys have any other questions, hit me up in the comments below. Make sure and go follow me over on Instagram. Of course, it's Bolt CRNA over there. So when I do future Q&A questions like this, you guys can take part. And that's Bolt out.